and thinking to give to any of the listeners out there or any people that, maybe are interested in understanding what their body is going through. What do you recommend besides the yearly annual physicals? What do you recommend for people to just make sure that your health is in check? Is there certain things that you think, because a lot of, like you said, a lot of these people, they might not even know, it might not even show up on your annual just basic blood tests or blood work, right? So what are some things that people can encourage or ask their doctor to check further, just in case, they're, I guess, being cautious because of family history or whatever it is? What types of things do you do preventatively to make sure that the body is working properly?
I'm glad you asked that. I tell everybody, make sure to tell your doctor, because most of the doctors do not do that, that when they check your cholesterol and everything, normally you should try to keep your total cholesterol less than 150 milligram percent and your bad cholesterol, LDL, less than 80%. But ask your doctor, besides checking their cholesterol and triglycerides and good cholesterol, bad cholesterol, check what is called as high sensitivity CRP, HSCRP test. What it does is that this is a special test. Try to keep it at 1 or below. You have very low risk, extremely rare of coronary disease. If it goes between 1 and 2, then you have average risk. 2 to 3 is high risk, and above 3 it is very high risk. And it is not simple CRP test. It is high sensitivity CRP test, and that predicts what inflammation is going on in your body. If your inflammation, because that is the cause. So if inflammation is very low, your high sensitivity CRP should be 1 or less. And if you tell it, they will always do it. I have patients who have told me, who have shown me the reports. So that I highly suggest. Other thing I suggest is, this study was done long ago in France. People eat wrong kind of food, all fatty food, all those sauces. And yet, the women over there live 2 years longer than our women here. And men live 1 year longer than our here. What is it that they are doing, we are not? And the answer, a American scientist over there spent 7 years and found out, was if they have to have even lunch, they spend 1 hour taking that lunch, not lunch on the run like we do over here.
Yes.
So what they do is, even if they are eating fat, they eat slowly.
Yes.
And they put down their forks and knives in between the bites, and then they chew nicely. Sometimes they talk also, and then they pick up again. So eat your meal slowly, spread it out, and don't eat if you are not hungry.
Yes.
So this is very important to observe. And if you exercise, if it is a strenuous exercise, do it half an hour for 3 times a week. If you want to do more, fine, but that's enough. And if you do brisk walk, then half an hour 5 times a week, or for 40 minutes 3 times a week, which is the latest now, that if you do 40 minutes, even 3 times is enough of brisk walk. So those precautions in the diet and in the exercise, never miss more than 2 days in a row between the 2 consecutive exercise days. You can't do 3 days, Monday, Tuesday, Wednesday, and that's it. You have to do Monday, Wednesday, Friday, and then you can skip Saturday, Sunday, but never more than 2 days between consecutive exercise days.
Yes. There's so many great things that you shared. I'm glad that we got this recording and this conversation in. I know there's so many things that you have to do too, and keep living the healthy lifestyle that you're doing. And I hope you're enjoying retirement and everything.